do.
Hi, my name is Meredith Drazy. I'm the Director of Physician Relations here at Reston Hospital Center, and I'm joined today by Dr. Camilla Hirsch, GYN surgeon here at Reston Hospital Center. Welcome.
Thank you. Glad to be here.
So, how long have you been practicing GYN surgery?
I have been practicing for about 35 years.
Wow. Seeing a lot of different changes in the medical community in that time.
I truly have.
Good. So what we wanted to talk about today, speaking about advancements in surgery and how things change, is indications or reasons why women would want to seek or need to seek treatment, hysterectomy, robotic hysterectomy, robotic GYN surgery. It's kind of an overarching sort of topic. So to be specific, I know you have a passion to do minimally invasive GYN surgery. So why don't we just talk a little bit about that? Why, what is minimally invasive or robotic surgery, and why is that an option for some women?
Well, it's really exciting to be part of practicing medicine at this time in history, because you may remember that your mothers and your aunts, if they had to have a hysterectomy, had a very large incision, had a very long recovery time. Mm-hmm. And now, first, most gynecologists try not to do a hysterectomy because we have so many treatments to avoid hysterectomy these days. But sometimes, at the end of the day, none of those treatments work, and it ends up you need a hysterectomy. So this is done through a series of very small incisions, half-inch paper cut incisions. We put the robotic 3D camera right at the belly button, at the umbilicus, and we can see inside the body probably even better than we used to be able to see when we had to do a large incision. Wow. It's just amazing. Come into the OR with me sometime, and with permission, of course, yes. And you can watch. And so we can disconnect a variety of internal organs, and instead of putting sutures around blood vessels, we have these little devices that are like miniature hands that can seal each little blood vessel so that there's much less trauma to the surrounding tissue, and then we can remove rather large problematic organs with a lot of special techniques through very small incision.
What are some reasons if a woman comes to you and she's having some problem, she's having pelvic pain or she's having bleeding? I'm sure all sorts of different variety of things bring women into your office. So what are some of these conditions that can be treated with this surgery?
Well, you mentioned pelvic pain, and there are a lot of reasons for pelvic pain, but one of the major reasons is endometriosis. And again, one of the nice things about the minimally invasive surgery is after several treatments of trying to use a medication for the pain, we do robotic laparoscopy, and we can use the robotic laser to laser away most of the endometriosis. Wow. and preserve the female organs as much as possible to help with fertility and with pain. Okay. It's called the firefly laser technique, if you want to look at it.
That's very interesting. I absolutely will. Now, I think, and I hate to assume, but I can imagine, since I'm a woman and I'm at that age where all sorts of conditions start coming up, that a lot of women are hesitant to seek treatment or seek surgical solution for a problem that they're having, because they are thinking of the old school hysterectomy and this long recovery, and they've got kids and they're working and all of these things that they have to contend with. But that's the beauty of what we're doing now and what you're doing with this minimally invasive surgery, right? So just give us a little bit of idea about what that recovery looks like, especially now compared to 15 years ago.
Well, 15 years ago, you would be in the hospital for 4 or 5 days after an open procedure. Now, depending on the case and the particular patient, we usually send the patient home the same day, if you can imagine it. The same day, you have this huge operation done, and you can go home the same day, sometimes the next morning. You can generally drive your car in a week. Depending on your work, go back to work in 2 or 3 weeks, at least part-time. Wow. Again, you remember the ad for the jeans. This is not your daughter's jeans. Right. This is not your mother's hysterectomy or myomectomy or a variety of procedures that we do.
Wow, it's really great to be a part of something, to be able to offer women such a a great alternative, like you said, when they've exhausted all these other sort of options and like I'm just kind of at my wit's end and I'm having the pain or bleeding and I don't know what to do. But to know that you could come to the hospital and have a total hysterectomy, have it done, go home the same day, and be able to take care of your family a lot sooner than you could, it's a good time.
One fact that many women don't know, because we use the word hysterectomy, and most people think that you remove every single thing, but generally we try to preserve the ovaries as long as possible, at least till age 60, because if you retain the ovaries, your risk of heart disease is less. So unless there's a problem with the ovaries, we leave them in and remove the other problematic organs.
Wow. Exciting stuff. Well, thank you very, very much. We're so thrilled to have you here at Reston, and I'm always so fascinated by what we can do in the OR these days. So I really appreciate the information, and I'm sure there's going to be a lot of questions and comments. So anybody, please feel free to leave a comment or question below the video, and we can always reach back out. Or if you have any other questions or have any questions for Dr. Hirsch to follow up, you can just go to restonhospital.com, submit an inquiry there, and look us up. And we appreciate you watching, and I appreciate you coming and giving us all the good info.
Thanks a million, Meredith.
Yeah, absolutely.